Come in. Hi, I'm Mary and I'm going to be your nurse today. I'm going to do an exam. Can you tell me why you're here today?
I'm just here for a regular routine checkup.
Okay. I've reviewed your history and I'm going to shut the door here, provide privacy. Are you comfortable?
Yes.
So I'm going to wash my hands and I'm going to get a set of vitals on you. Let me grab my equipment. First I'm going to take your temperature. 97.1. And this is a pulse oximeter. It's going to tell me what your oxygen saturation is. While that's on, go ahead and get a blood pressure from you. And while I'm standing here, I'm also looking at your skin. I'm observing for any bruising, lesions, abnormal. And 98% room air. Pulse is 64.
Is that good?
That's good. 99, you're getting better. 100%, not many people. I'm also going to look at your chest rising and falling to see if it's asymmetrical. I am checking your respirations. And while we're doing that, I'm going to go ahead and document this. We'll see what that is. Next, I want to go ahead and I'm going to do head to toe for you, okay? Meanwhile, I've looked at your skin. I'm checking for moisture. I am checking for discoloration. I'm checking for any abnormal bumps or lesions or anything like a mole that's large for carcinoma. I don't see anything on you. You look good. Your blood pressure is excellent. It is 130/70. Your pulse is 76. Within normal limits. And have you had any difficulty with anything? Shortness of breath? No pain? Any pain anywhere?
No.
Excellent. I would have gotten a weight on you when I asked you to come in. I can get that real quick. We jump down and take a weight.
Can you please assist me?
I can.
Thank you.
Okay. Oh, excellent weight. 140. And how tall are you?
5'4".
5'4". Okay, great. So I'm going to go ahead and start to check with the head. And I'm going to look at the skull. And I'm checking to make sure you don't have any lumps, pain, nothing. Okay, let's check your face. And can you smile for me? Oh, it's beautiful. I'm going to check in your ears. I have check your other ear. Okay. And I'm checking in your nose and your mouth. Can you say ah? Nice. Can you stick your tongue out? Can you put your tongue back in? Okay. I'm going to check your eyes. Checking your sclera, making sure there's no discoloration on the corneas. I'm checking, make sure there's no discharge. And I want to check your eye movements. We could do a Snelling chart for that too. I'm going to follow my finger. Nice. Good. Now I want to check your neck. I'm going to put my hands on you. And I'm I'm checking the nodules to make sure there's no swelling. I'm making sure the trachea is in line. And from here, I want to go ahead and start to inspect your back. So I am checking shoulders, checking your skin, and we will just go all the way down. And can you take a deep breath? Thank you. And I'm going to percuss. Okay. Everything is good, and now I'd like to listen to your lungs. I'm listening for anything abnormal. Take a deep breath. And comparing those long sides. Again. One more. And over to the lower lung. Okay. It all looks good. Your lungs sound very good and clear. Can you also, for me, I'm going to do your upper extremities next. So I'm going to come down your shoulder and your arms to your fingers. I'm going to check your capillary refills, CMS, temperature. And then I'll look into your mouth too to check when you open up for me again. I'm checking your color, your membranes. I'm looking to see if you have moisture on your skin. And it looks good. I'm going to check all the nodules in your wrists. And then just some rotating. And we'll compare it to the other side. And, ooh, there's a little creak. Okay, can you put your hands forward? And then can you abduct, flex, extension? It looks good. Okay. Next, I think I want to check your cranial nerves. This is cranial 1 is for olfactory. That's for your smell. I think we'll skip that because I think you're no problem with your smell. For your eyes, we would do the smelling chart. That'd be your cranial nerve 2. For 3, 4, and 6, this one was the eye movement we did. We already tried. We did that one. And then we have one more for you for your eyes for cranial 5. Are you ready? This one is a test for you. Okay, you want to take your finger, touch mine, and then touch your nose. Okay, and the other finger, and back to your nose. And back to me. Good job. Okay, next, I think we should check for your whispering. I'm going to check your ears. I'm going to whisper and you tell me what I say. 21, okay? 14, yes. And I'm going to have you open your mouth and say, ah, nice. Okay? And next we want to do is your, did your neck? I think I did your back. Let's do the anterior front of you. Okay. So, let's start. I'm checking JVD. I will measure your JVD. I'm going to listen to necrotic. checking for bruit. Okay. Now listen to your heart. I'm checking your skin while I'm looking. Go down to your apical. I turn it over to listen to S1 and S2. I'm checking for any abnormal sounds or murmurs. I do not hear anything. Okay. And if you would for me, do you want to go ahead and lie down for me? I'm going to check
my back or
on your back for me. Yep. Are you comfortable?
yes.
Okay. So now we could do a breast exam. I'm going to verbalize it. We would go around in little circles. And we're checking for any nodes, nodules, making sure there's no tenderness. Have you done your breast exams also when you're in the shower?
Yes, every month.
And we would check under your axillary for any. Is that tickle? Sorry. Yes. And we'll come down from there. And I will inspect your abdomen. I am going to inspect and make sure there's no bruising, no deformities, and it's rising in same size. Okay, and now I will listen. Active. Okay. Nice. And I'm going to lightly palpate. Any tenderness? No? Which is some heavy palpation. Feeling the size of the liver, the aortic pulse, coming over to the kidneys, making sure. Okay. And from here, I want to go ahead and I will come down and do your lower extremities. We'll start with your legs. We're checking skin. We're going to check movement. Legs, I'm checking outside. And then I want to check for your pulses, your peripheral vascular. We will check integrity. Oh, I get that one wrong, sorry. Femoral artery. And we'll compare. Popliteal. May I take your shoes off?
Yes.
Okay. Checking CMS. Oh, they're cold. Do you ever have any numbness or tingling in your extremities?
No, because we're cold.
All the time. Flexion, extension. Good. Okay. And we'll try the other leg. I'm going to bend this one up. This one down. And out. Back in. Okay. And so I think next I want to do a feminine exam for you. So I would do exam on your perineum. I would check your for any swelling, discoloration. We're going to do a pap smear. We're going to check your cervix. Is that okay? I would provide privacy for you, and then we'll put you in the correct position. Okay. And I think what we need to do is, we would of course make you comfortable and drape you for privacy, and then we also check the rectovaginal, which is your rectum. We check for anything to miss. I think that's everything. I would record all of my findings, and my findings is she is a medium height, medium weight female who is healthy and has no concerns.